one of the areas that I'm most excited about, if I think about the impact of AI, is utilizing data that we already have much better. Healthcare today is roughly 30% of all global data. That is a striking figure if you think about how much AI is actually utilized to generate outcomes. And I'll give one example, actually Mount Sinai have been a leader in, which is coronary artery calcifications. So those that don't know, it's becoming very hot in the VC circles to do this calcium scoring test, but effectively it's a study that you do. It's a CT of the heart, and effectively it's simple terms, and David, please excuse me if I'm butchering it, but it's a great predictor for heart disease. One of the best predictors we have that we can do in a fairly screening fashion. But today, most people have to ask to do this exam, and not many people know that they can do this exam and have the prediction of heart disease. If they find any predictor, they can then treat it, for example, with medication like statins or behavioral. So heart disease, if you catch it early enough, not easily, but somewhat preventable. But the problem is you have to ask for it. I think we have this immense opportunity to give it automatically. And one of the amazing things that we're running together, and Mount Sinai have been a leader in the nation on, is saying, look, we already have all these patients that are getting their imaging of the chest. Why wouldn't we already screen them for that disease? And then, so when a patient is getting a CT scan of the chest, they're already, now with AI, right, Mount Sinai is already looking for this calcium scoring, and they can give you that predictor. Not only that, now the AI have these agentic capabilities that connect the imaging information with your clinical history. So it's not just based on an image, it's based on your holistic patient view. And based on that, they can bring back patients and tell them, hey, you potentially have heart disease risk. You should you should be seen by a cardiologist. And the numbers are pretty striking. It's hundreds of new patients every year that didn't know they have heart disease risk that now can get it. Think about you as a patient getting that call. You do whatever it is, you fell down a few stairs, you're doing screening for something, and then you get the call from a health system that proactively cares about you and tells you, hey, you actually have heart disease risk. You should see somebody to treat that. I think there's immense opportunity with that if you think about it from a population perspective.
Can I add to that, Adam, for 1 second? The partnership is very important here, because one of the hidden treasures that we have in terms of advancing healthcare is millions of images and millions of electronic health records. And to be able to put together predictive models, which include what the radiologists refer to as opportunistic screening, meaning that it's already there on a chest CT or an abdominal CT. We see osteoporosis, calcification of coronary arteries, potentially nodules in lungs. These are things that could help us provide much better care to our population at large. When you think just about osteoporosis, for example, it's an epidemic in our nation, predominantly affecting women, predominantly people over 70. And if we can effectively identify and get people into treatment programs, we can prevent fragility fractures and extend people's, contributions to society and their mobility and their quality of life.